A serious condition that can develop in anyone at any time is deep vein thrombosis. DVT is often underdiagnosed and occurs when a blood clot forms deep in the vein. Unfortunately, about half of people with DVT have no symptoms at all. The following are the most common symptoms that occur in the affected part of the body: swelling, pain, tenderness, redness of the skin. If you have any of these symptoms, you should see your doctor as soon as possible. Dr. Charlie Hahn of Veins, Florida, explains that DVT clots usually develop in the lower leg, thigh, or pelvis, but blood clots can form in varicose veins as well.
Deep vein thrombosis, the clots that are located within the deeper vein, usually they're in the pelvis. And those clots can travel to the lungs, which can cause pulmonary embolism. For varicose veins, they tend to be superficial. Those blood clots tend not to travel. Varicose veins can cause blood clots in them, and then they cause a tremendous amount of pain once the blood in them become clots. And we call the thrombophlebitis. And also, the larger it gets, they tend to pull more blood, which cause skin changes, color changes around these large varicose veins. It can cause skin ulcers, which will take a very long time to heal. And also they can cause a large amount of bleeding if they got injured. For thrombosis, the varicose veins, they carry a large amount of blood, and that's why those veins are huge. And a lot of times they stay there for a long time. And for some patients, they can develop a large blood clots, which is not as dangerous as the deep vein thrombosis. They tend not to travel. But what they can do is they can continue to grow and involve a large portion of the varicose vein and cause local inflammation, which is swelling and redness and edema, and these are very painful. The potential dangers is when you start noticing at the end of the day, after a long day walk, standing up, and your leg get really swollen, especially around the ankle and the lower part of the leg. And also they tend to ache when you put your foot down at the end of the day when you're sitting on the sofa. And also you notice some skin changes. Instead of nice looking skin, they tend to be kind of rusty looking and start having small ulcers. And those are the warning signs.
Dr. Hahn reminds us that it's important to know about DVT because it can happen to anybody and can cause serious illness, disability, and in some cases death. The good news is that DVT is preventable and treatable if diagnosed early. For more information on the treatments available at Veins, Florida, follow the DVT story icon on our homepage at yourhometownhealth.com.